All right, and we are back after 2 weeks of being off. It's so good to be back. Thank you so much for letting me chat with you a bit. We got some great stories to talk about today, so let's get started. Hello, my name is Dr. MarkAlain Dery. I am the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana. You've seen me do these updates now for the past few months in conjunction with the leadership of the ACOI. I hope these messages are helping you to keep up with the latest on COVID-19. Now, I know many of you are in the thick of the fight, and I'd like to thank all of you on behalf of us who focus on daily on infectious diseases for a living, and certainly on behalf of the ACOI. Now, I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases subspecialty section. And as we are facing this once-in-a-lifetime global battle, I want to hear from you, my colleagues, who are experiencing the fight from their locations. No matter where you are in the country, I provide my contact information at the end of each update, so please listen for that. I hope you take me up on that invitation to reach out. So moving forward together with the ACOI, we will continue to share information as it becomes available, as well as some of the most hopeful progress that we are seeing. So let's get started. All right. So today we're going to talk a bit about aerosolized versus droplets. So what does it all mean? So before we get started, let's quickly define some terms. I'm going to try to make this as straightforward as possible. I think that this is a confusing science, but I'm going to try to whittle it down. So when we talk about these droplets that you hear about, COVID-19 droplets, these are large infectious droplets. These are generally greater than 60 micrometers in diameter, which is roughly the diameter or the size of a human hair. Now, when these droplets desiccate a bit, when they become dried out a bit, they become smaller, right? Because there's less mucus around it. It's dry, and now these become small infectious particles. And these droplets are generally 10 to 16 micrometers in diameter. Now, these are referred to as being aerosolized, okay? Now, lastly, let's talk about what happens when a droplet is less than 10 micrometers in diameter. This is referred to as an infectious droplet nuclei, or this is what we refer to as airborne particles. We have droplets, we have aerosolized particles, and then we have airborne particles. Okay. So droplets are big particles covered in mucus, and they drop out of the air in about 3 to 6 feet. If the droplet particle happens to remain in the air and it dries a bit or it desiccates, it can travel quite a bit further, and this is what we refer to as being aerosolized. And that is what this story is about next. And lastly, an airborne particle does not have any moisture at all, and this is quite small, and it can travel long distances. So with that, let's go ahead and get started. So the latest research that is bringing a new controversy to light is on whether or not aerosolized droplets of the SARS-CoV-2 virus can spread the virus to healthy individuals. Remember, we're not talking about droplets now, we're talking about aerosolized, right? So we all know that the World Health Organization has said that the virus primarily spreads through large respiratory droplets that are expelled when an infected person coughs or sneezes. But there's some comfort with this and understanding that since those droplets typically fall to the ground very quickly and they don't stay suspended and hang in the air, that's a good thing. Now, the organization has been somewhat skeptical whether the coronavirus can spread through smaller aerosolized droplets, saying that while such transmission is possible, it hasn't been supported with strong evidence. And I will say, folks like myself who are epidemiologists, who have been following this, man, there's no other way that you would have such an infectious entity that has been transmitted and spread to so many other people. This is not droplet spread, and quite frankly, I'm a huge fan of the WHO. I don't know what took them so long. But anyway, let's look at the data. So a new study out of the University of Florida just published some reports. This is not peer-reviewed, so we need to think about that. That there's new evidence that's showing that the virus can, in fact, hang in the air in smaller aerosolized particles. And this changes everything. The way these researchers collected the samples is that they took two different aerosol samples, one from a distance of 7 feet and the other one from a distance of way over there, 16 feet, right? And they were taken from hospitalized patients with COVID-19. Please keep in mind these samples were collected from a hospital, and the hospital rooms undergo 6 air changes an hour, plus the rooms are all equipped with efficient filters, ultraviolet irradiation, and other safety measures to deactivate any coronavirus samples present in the room. Remember, this was a coronavirus or a COVID unit. So all in all, this means that they had some pretty clean air, right? But what they found was that the particles they isolated from the aerosol samples could actually infect cells in a lab dish. And they also found that the genome sequence of the coronavirus particles that they had isolated was identical to the sequence of coronavirus particles they collected with the swab of one of the COVID-19 patients in the hospital room where they gathered particles. Now, I think of a droplet like a bowling ball. It drops fast due to gravity. But on the other hand, aerosolized particles are more like BBs, right? They go a lot farther since gravity has very little effect on smaller particles like that. Now think of the implications of how far these aerosolized droplets can spread compared to bigger droplets. Now there have been some mixed reactions to the findings of the study, but some have called it the smoking gun. Others have said that there isn't enough virus in those aerosolized particles to cause an infection in anyone. And to be honest, we don't actually know what the infectious dose is for transmission of COVID-19. Another researcher yet said that it does prove that being indoors and within 6 feet of someone isn't enough protection as being outside. And of course, as millions of children are heading back to school, this is a disturbing finding. So I wanted to talk about the next, I thought, really fascinating story that came out in the past week, and that was which masks are the best masks. So now that we're all finally getting on the same page, in fact, let me show you my cool mask here. This is look at this mask. This mask was made by a friend of mine, and you can see it has the cool COVID, the plague doctor. All right, isn't that cool? It has the plague doctor imagery on it, right? From the plague, right? Yersinia pestis, right? From the Black Death. So this was a gift to me from plague doctor to plague doctor. Anyway, I thought that was kind of cool. I wanted to show it off. Okay, and I got one more great mask to show off on the next video. Okay, so now that we're all finally getting on the same page about the effectiveness of wearing masks to reduce virus spread, the question now is which masks are the most effective, and that was what was studied just recently. And I think it is safe that never in America has there been such a selection of face masks for virus and bacteria infections. There are multiple colors, fabrics, some have messages like vote, or they make a fashion statement. I have another mask that I'll show you next time that says mask up, COVID down. But when it comes to what offers the best protection, there's no doubt that the surgical grade masks or the N95 respirators, of course, are hands down the best. But for those that are not in the medical field, they're not likely to be equipped with any of these masks. And with the shortages that have existed previously, we need to limit those types of masks to the general public so that healthcare workers have the proper PPE protection that's available to them. So what about the single-use paper masks or homemade cloth masks? Well, what the study found was that tighter fitting ones are obviously the best, but the CDC said that in any covering, including bandanas, are better than nothing. Both scarves and bandana material are less effective, but they still captured a fraction of those droplet particles leaving the mouth. Now, a study actually done in April looked at household materials that best remove particles of 0.3 to 1 microns in diameter, which is the typical size of the virus. And what they found, and they found that vacuum cleaner bags, which of course makes perfect sense, right? And heavyweight or quilter's cotton or multiple layers of material are very effective in preventing that transmission of virus. But I love what the spokesperson from the Infectious Disease Society of America, which is my organization, said that the best mask is the one that's worn correctly. I'm going to argue and say that the best mask is the one that has the plague doctors on it. So plague doctor to plague doctor. Okay, anyway. There is actually one wrong choice, and that was what the big news was this past week, according to one study. And those are those net gaiters, right? And those net gaiters actually break up the droplets into smaller particles, aerosolizes them, right? And disperses them in the air. So please do not choose that. And it's funny that there is finally a study that has actually been done on this. There's a great video that shows how the study was done with lasers. It's surprisingly easy to do, and funny enough, it doesn't actually take an expert to do it. Literally anyone can replicate it, so please check out the link in our references below. And so with that, please stay on the lookout for our regular updates, and to read more from the sources used in this report, please go to the ACOI. Hold on, let's do it again. acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. Please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.